Listen, high blood pressure is not just a number on a chart. It's a silent killer. It could be quietly destroying your body right now while you feel perfectly fine, like it happened to my cousin. No headaches, no chest pain, no symptoms, and then one day, bam, a heart attack, a stroke, kidney failure, or worse, hit you unexpectedly. But it doesn't have to be you. I'm going to show you top 7 complications of high blood pressure that most people overlook and how you can stop them before it's too late. Hello friends, I'm Dr. T. Board Certified Cardiology and Lifestyle Medicine. Let's dive in. Number 7, damage to sexual organs. At number 7, let's talk about a topic nobody wants to admit, but it matters. High blood pressure. Damage the small blood vessels that supply your reproductive organs. In men, this often leads to erectile dysfunction or ED, which can be an early warning sign of a vascular disease and a heart attack. Why? Because here size matters. The penile artery is about 1 to 2 millimeters wide compared to the arteries that supply blood to your heart are 3 to 4 millimeters wide. And the carotid arteries, for instance, that lead blood from your heart to your brain through your neck are 5 to 6 millimeters wide. So the plaque in the penile artery will cause trouble with blood flow years before your heart arteries will do to your heart. That's why ED is the canary in the coal mine. And in women, it can also reduce blood flow, causing decreased arousal and satisfaction and libido. If you've noticed changes, don't just chalk it up to age. It could be your blood pressure speaking up. And here's the thing, fixing the blood pressure often improves these symptoms. And number 6, damage to your eyes. The back of your eyes, the retina, is like the Kodak film in the old cameras or the digital sensor, the newer ones. Your eyes have some of the smallest, the most delicate blood vessels in your entire body. And when blood pressure is too high, these vessels can thicken, they narrow, or can even burst, leading to a condition called hypertensive retinopathy. What it means is high blood pressure causing trouble on the retina, on the back of your eyes. And it can cause blurred vision, it can cause a spot, or in severe cases, blindness. And what's worse, you might not notice until serious damage is done. An eye exam can often spot high blood pressure damage before you have symptoms. If you're 50 or over 50, you need to have an eye exam once a year. And number 5, damage to your legs, to your lower extremities. High blood pressure also affects your legs and feet. It narrows the arteries, reducing blood flow to the lower extremities. And this condition is called peripheral artery disease, or PAD. And symptoms include pain while you're walking in your thighs, on your calves, and numbness, cold feet. And sometimes you may notice you're losing hair in your legs, and could lead to slow healing sores and ulcers. And left unchecked, it can lead to severe infections or even amputations. If you've noticed leg pain or cold feet, don't blame it just on age. It could be a warning sign from your artery. And number 4, my cousin's story. The high blood pressure, you often call the silent killer for a reason, because it quietly damages your blood vessels over time. And one of the most dangerous complications is it's called an aneurysm. Aneurysm is a bulging in a weak spot in the artery wall. Think of a weak spot in a garden hose. If the pressure increases, the weak spot is going to stretch and bulge. And if it bursts, it can cause life-threatening bleeding. And this can happen in various parts of the body, but they are especially dangerous when they occur in the brain. It's called a cerebral aneurysm, or in the larger artery in your body, the aorta, called the aortic aneurysm. Both can rupture suddenly without warning, often with fatal consequences. And the scary part, most aneurysms don't cause symptoms until it's too late, which is why keeping your blood pressure under control is one of the smartest moves you can make for your long-term health. Here's what happened to my cousin. He was at work. He was painting a house. He was in a ladder, and he fell, collapsed, and died. Autopsy showed, in fact, he had a cerebral aneurysm. And number 3, damage to your kidneys. Your kidneys act as your water filters. They clean about 50 gallons of blood a day. And high blood pressure leads to scarring, causing the tissues to weaken and the tiny vessels inside them to lose the ability to filter waste. This would lead to chronic kidney disease. You're going to start retaining fluid, especially in your legs, but it could be around your eyes as well. And in severe cases, could lead to dialysis. Well, you may be wondering what actually causes kidneys to fail in the first place. Well, the top 3 culprits are pretty clear. Number 1 is diabetes. The high blood sugar over time damages those tiny filters inside your kidneys. But number 2 is high blood pressure. It scars and weakens the delicate blood vessels, just like it does to your heart and your brain. And number 3 is something called glomerulonephritis, an inflammation of the kidneys filtering units. And together, these 3 causes are behind about 75% of cases of kidney failure leading to dialysis. Here's the good news. 2 of these, the diabetes and the high blood pressure, are highly preventable. If you want to learn more about high blood pressure, watch this video, Top 7 High Blood Pressure Symptoms You Should Never Ignore. I'll put a link above and on the description below. And number 2, damage to your brain. Your brain depends on steady, healthy blood flow. And high blood pressure makes arteries in the brain stiff and narrow, increasing the risk of transient ischemic attack, a TIA, also called a mini stroke, or a full-blown stroke, or can even cause vascular dementia, that it's a memory loss caused by poor blood flow to your brain. And high blood pressure is one of the biggest culprits. If you're having trouble remembering names or misplacing things, don't just chalk it up to old age. Get your blood pressure checked. And finally, number 1, the hardest working muscle in your body, your heart. Remember, your heart beats about 100,000 times every single day. And high blood pressure makes your heart pump harder than it should, causing the heart muscle to initially thicken and stiffen. Think of your heart lifting like a heavy weight. The heart initially will compensate to getting thicker, develop what you call hypertrophy. But over time, this weakens it, raising your risk for congestive heart failure and dangerous arrhythmias and even sudden cardiac death. And in addition, high blood pressure leads to blockage in the pipes in your heart, leading to angina, unstable angina, and heart attacks. Don't be a victim. Know your numbers. Blood pressure is one of the most controllable risk factors out there. And here's the best part. You can often lower your blood pressure naturally without pills. And to learn more, watch this video, Lower Your Blood Pressure Naturally Without Medications. I'll put a link above and on the description below. And always remember, your health, your most precious asset. Take control. See you next video.